So the rationale behind this idea was we are treating very young patients, young female patients, young male patients with iliac vein obstructions, which definitely needs radiation exposure to treat the underlying disease of these obstruction, meaning we need to expose these patients, in some cases, to a lot of radiation. And we ask ourselves, is there a way to reduce radiation? And we now have techniques available like intravascular ultrasound. So we analyzed if IVUS could help us to reduce radiation exposure. So it's a 228 patient cohort analysis. Patients with just a compression, May-Thurner syndrome, but also patients with severe post-thrombotic syndrome, in which we performed endovenous stent implantation. So we checked retrospectively if IVUS guidance reduced the radiation exposure, contrast media exposure, and Kerma-area product using IVUS for recanalisation. So we were very surprised to see that IVUS could definitely reduce fluoroscopic time, could reduce radiation exposure with that, and therefore could reduce Kerma-area product, especially in patients with post-thrombotic syndrome, which sometimes we need a long time for technical reconstruction of the obstruction within the iliac vein system. Based on our data, I definitely would like to recommend that IVUS should be a standard tool which we should use for endovenous stent implantation, recanalisation. It avoids prolonged radiation exposure, it reduces Kerma-area product, and I think this is a good argument, especially for the young patients, to avoid any complications with prolonged radiation exposure. IVUS alone is not possible. Just from a technical standpoint, we need fluoro to precisely define bony landmarks, where to start with stent implantation, where to end with. But we can get a lot of information from IVUS analysis. IVUS helps to reduce radiation exposure significantly.